I'm Laura Jensen, and I was the lead for this team. This is the order that we're going to be speaking in. I want to just introduce everyone on our wonderful team, Dr. Rye and Ashley from the pharmacy weren't able to be here today, but they were a great help during the week. So our project focused on enabling medication delivery to the Herbacid home on the day prior to the residents' admission. So when we looked at the current state, we found residents were being admitted with no medication on hand, sometimes no orders for medication. That was resulting in missed doses for those residents on the first day when they were already making this huge move. So we were finding that the transition was not smooth for the residents. Our theme was to eliminate the defect of medications arriving at the Herbacid home on the same day as resident admission or later, which we were seeing, and therefore to prevent missed medication doses due to not having the meds on hand. So this was an interesting RPIW because it crossed over so many departments. So home care, acute care, long-term care, and the pharmacy were involved. So this is our pre-Kaizen value stream map. So you can see we have a couple different lead times, both for an acute care transfer to long-term care and from an admission from the community. You can see that the resident moves to long-term care in the middle of our value stream map, the third last step. You can see the orders for medications are processed after that and delivered after that. So we knew that was our main goal, to fix that. And you can see a lot of starbursts at the top that the team will speak to. For our baseline data, we looked at space in the soil utility room on Lakeland Trail, where we've got 44 and a quarter square feet of space there. We had 343 items in that room. We had a walking distance for the Herbacid home nurse when admitting a new resident, clocked at 1,945 feet of travel. The home care placement coordinator was taking 42 steps to send the MDS assessment to the long-term care home. We had a lead time of 6 days in the community and 5 days in acute care. And when we looked at defects, we had 63% of our admissions arriving without med orders 24 hours in advance. We had 100% of our residents not having medication on hand at the time of admission. So that was because the processes dictated that they wait until that admission arrives and is confirmed, and then the pharmacy processed it. And we had 56% of residents missing doses on the day of admission. As you can see, we had a pre-Kaizen at a score of 1, and I'll just mention our cycle time, which is the approximate time it took a physician to complete those medication orders that we were asking of them. It's 15 minutes.
For this RPIW. We looked at two different tack times through this. We started off looking at how often does the placement coordinator produce paperwork for an admission, and that came to around 459 minutes or 7.65 hours, so basically once a day. Then we realized we were focusing a lot more on Herbacid, and that we really should look at what the demand function was for that. And basically every 7.7 days there's a need for an admission to occur. We looked at a number of things, information on the admission. As you can see from this one, we're really looking at when do the orders come through for people being admitted. You'll see most people get those orders on the day of admission. There's a few that come the day before, and some that even come after admission. And this was problematic because when it's coming the day of, the medication isn't arriving until after that resident has come. We looked at kind of the flow of people kind of coming through the work kind of in advance. The placement coordinator and the physician both had very small amounts of time. Then the day of admission, the nurse was doing about 2 hours of work on paperwork until the admission paperwork was completed. When we look at that information kind of over the time period, we end up with kind of the admission really taking place over 7 days. And, basically, you can see there's a lot of time lag in between different pieces of paperwork taking place, and that really there's a ton of work done after the admission by the long-term care nurses.
name is Chrissy Hunter, and I'm an assessor with Prince Albert Home Care. And I was part of the team that looked at the doctor's orders and the stuff done before someone was actually admitted into long-term care. So we identified 2 issues. One was the orders to the physicians needing to get to them earlier, and the second was the time wasted confirming a resident with the facility. So what we actually did was do some standard work for long-term care placement coordinator, for acute care, for the DOCs, and the pharmacy as well. So this first picture was showing the summary of the old process, which was faxing, and the new process being emailing. We wrote a standard work for the long-term care placement coordinator and the DOCs. We turned the fax system into an emailing system, and it established some timely, effective communication. We decreased the work time from approximately 13 minutes to 2 minutes with every time there's an admission to any long-term care facility. This second idea summary is looking at the time that doctors need to get the information in order to complete the doctor's orders in a timely manner. So the standard work that we developed is regarding the long-term care placement coordinator and acute care. So this was developed to obtain medications information prior to giving the doctors the physician so that they can more effectively and efficiently complete their doctor's orders, getting them to pharmacy in enough time so that the medications are actually at the facility the day before the resident has their admission. So with the medications that the doctor's orders we actually did, we did a mock-up, and prior to the old way versus the new way, the doctors were actually able to get it completed quicker, and it was actually well received by the community physicians that we presented the idea to. So by us addressing these 2 issues, we actually decreased the amount of physical work to communicate effectively, and we increased the information gathering in a timely manner to support the physicians to get the orders to the facility and the pharmacies a day prior to the admission of the resident.
Thanks, Chrissy. Good afternoon, everyone. I'm Marcus Herdan, and I'm an anesthetist at the Victoria Hospital. I've been a participant of the workshop. As we heard, the medications do not necessarily accompany patients in their travel from home care to that home. And when we spoke to a number of physicians, what they wanted was advance notice. So on this cartoon, you'll see the Vikings arriving without any advance notice and totally unprepared. But on the other hand, if we saw them in the distance, we'd be able to better prepare and warn everybody to go. So that's medicine, Dr. John Drive. 56% currently have interruption of their medications because those orders don't arrive on time. So we spoke to a total of about 16 physicians, meeting them at the Corporate Health Care Center on level 6, speaking individually to physicians by phone, texting. What they told us was that they really needed adequate advance notice to complete the orders, and one would even prefer knowing about it months in advance, so appointments can be arranged with family and to discuss advanced healthcare directives, for example. Home care, this was the previous form that accompanied the request for orders, and we've somewhat streamlined it or made it more user-friendly, adding an option for the physician to print out a patient profile instead of filling everything in manually. And so that's part of streamlining it. And the timing also was standardized to set 3 days before sending it to physicians to fill it in by 48 hours or 2 days before, and the pharmacy to receive it the day before to dispense the medication. And here we see a busy physician who might postpone the orders, and they need time. So we need to allow for the time that they need, and a day seems to be adequate. They're either going to do it when they get it, or by the afternoon that day, or the next morning, and that would be within a day. And it's either going to be themselves, or if they're on leave, they're not a physician on call. that brings us to how they notify of us of their leave. Presently, there's no requirement for them to tell us who's covering with their own leave, and so home care placement coordinator may not know whom to contact, and direct communication is better. So we might modify the form to include that, but also to include the home care fax number, placement coordinator's fax number, so that they could inform home care when they're faxing back the information. A mock exercise was done as to how long it takes to complete them, and it took about 7 minutes 50 seconds, and so anywhere between 5 and 15 minutes to do it. This would be our communication to the physicians. We've drafted a letter, and this will be sent out by the senior medical officer's receptionist, explaining the new work standard expectations, and that will facilitate the doctors collaborating and cooperating with us. I think I've covered virtually everything. Yeah, the next, over to you, Brian. Thank you.
I'm Claudia Driscoll, and I have been invited to be a representative for the residents and families in making some, or having reassurance that medications will arrive before I am admitted. That was our goal, we need the medications to be there when a resident is admitted. What that means to both the resident, family, and staff is such a magnitude that you can't even explain or want to experience. To the resident, that might be the only one item that they still had control of, maybe the family as well. And to come with such emotion on that first day, I'm in pain, I'm confused, I can't sleep, and that just increases my anxiety and worrisome. For the family, that is huge. When they know that the person they love is being admitted, they can't get the medications that they need. To the staff, it might mean, how do I help this person sleep? How do I relieve their pain? How do I reduce that anxiety and behavior that is not normal for them? They might be crying out, they might be screaming, they might be cleaning. Bottom line, how we collected our data was partly all of us as team members, then going to the Herb Bassett ward and talking to all levels of staff, unit clerk, care providers, registered nurses, licensed practical nurses. We got their input as to thoughts, how could this be achieved? And we were still in a bit of a dilemma, so we had to sit down as a team again and say, we have to start working on it 3 to 4 days in advance. We can't do everything the day they come. So that's where it began. So also what we looked at, we have the responsibility on the registered nurse and the licensed practical nurse. What about all the other care providers that are working with us? The unit clerk. The unit clerk is now involved. The caregiver, care aide is also part of the admission process. Now it's divided then, and other people will explain how that works. But yes, everyone is has equal importance, equal responsibility in the admission of Claudia Driscoll in the future. So in place then, we have started, others will speak to it, but it starts now 3 days ahead. We gather as much information we can. It's on a flow sheet, the role of the nurse, the role of the ward clerk, the role of the care provider or care aides. And that has been tried and brought to them, and I could see the smiles and agreement and participation in all these decisions. The final result is that we have been able to set up some work standards that affect people that have not been involved in that care, and that will be included in the ongoing training so that all of this can be sustained forever. And so contributions then are from all the care providers on the unit at the Hurd Nursing Home, so that my medications will be there when I'm admitted tomorrow. Thank you.
Hi, my name is Maureen. I'm one of the registered nurses at the Hurd Home. And as we started, as Claudia has mentioned, as we started this process of wondering how we can do this job better, we did realize that there is a substantial gap of responsibility from when home care drops off their package of admitting papers to the Hurd Home and the day that the resident is actually admitted to Hurd Home. There is a gap of about 3 or 4 days from when that information is provided, and so we decided that that gap of 3 or 4 days was when we needed to act more promptly. We needed to take ownership of the residents at that time, and so we've developed a 3-day admission process during which we'll have more time to make our phone calls to the physicians. We'll have more time to have interviews with the families so that what they feel the residents are taking versus what the doctor feels the residents is taking, we can do some med recs on that part. So we're going to be doing a 3-day process. We had an opportunity today to observe both an admission and a pre-admission interview according to the system that we want to put into place, both with some successes and both with also finding that there are mistakes even that we were able to catch today as opposed to catching Monday. And our meds are received for admission today, and we're very happy with that results.
Good afternoon. My name is Ryan Tana. I'm one of the continuing care aides, one of the continuing care aid staff on the Lakeland Trail. I was given the task of doing and applying Kaizen fibers to the soil utility room on the Lakeland Trail. As you can see, pre-Kaizen, this is what the soil utility room used to look like. Accessibility of equipment and safety are a main concern when you, initially when you first see the rooms. Pre-Kaizen was determined 3 departments were using the staff, soil utility rooms, Lakeland Trail staff, housekeeping, and maintenance. So after interviewing and getting inputs on what they needed, on how the 3 departments are using the soil utility room, equipments were then taken out of the soil utility room, and then out of the inputs that we got, we based on we started putting back all the equipment depending on the inputs that the staff and the manager gave us on what equipments are really needed inside the soil utility room. So basically, all of the equipments that are not necessary in the soil utility room were given, were put back to their respective departments and their respective storages. So 343 items were actually inside the soil utility room pre-Kaizen 5S, and now it's about, it went to 83 items were ended up, that was put back and categorized inside the soil utility room. So as you can see on the final inventory post-Kaizen, 83 items were put back that are really necessary for the task of the CCAs of all the 3 departments. Calculated savings are $79, and inventory improvement was 75.89% of equipment that were in.
We just wanted to show this chart, which basically shows the difference between the pre and post. What you can see is the admission process is happening over a much shorter period of time. We're also balancing the workload of the nurses from the admission day into day -2. In terms of the newspaper, we accomplished a lot of things. What's left is really looking at some of the paperwork for admission that was outside of the scope of what we were doing. Then in a sense doing some training of staff, ensuring that the care aides, the home care nurses and the nurses on long-term care have their work completed and understand what their roles are.
Okay, so we're running short of time, but I just want to touch on our future state process and map. So we did end up reducing the lead time of our process by 51%, which wasn't our main goal, but it was good to see it reduced. What we wanted was to make sure we had the right number of days, the right amount of time to get done everything we needed to get done for a safe admission. We reduced the time, but also we got those boxes in the right order where the medications are arriving before the resident. So we have a lot of improvements on here. Our defects are looking at like a 0% improvement only because we didn't have a process to measure in our post-state because we didn't have an admission, but we are confident they will be great improvements. So in summary, using 5S sealed utility room on her Bassett home is now safer. We've updated the request for doctor's orders and they sent 3 days prior to admission. Doctor's orders are completed and back to the Herbasset home in the pharmacy 2 days prior to admission. And the meds will be delivered the day before admission so that on admission day, the resident receives the meds on time, every time. And finally, the pre-admission family meeting of the Herbasset home is going to improve that workflow for the staff doing the admission as well as the experience for the resident and their family. A lot of thank yous. The staff were fantastic in all the areas that we touched, and a big thank you to my team who were fantastic